Well, high blood pressure is a measurement that we take to give us some idea of the health of the cardiovascular system. Now, high blood pressure people think of as a disease, but it's really not a disease. People don't die of high blood pressure. What do they die of? They die of arteries that fail. In the brain, you have a stroke. In the heart, you have a heart attack. And a precursor to that is the blood pressure often goes up. And why the blood pressure goes up is because the cardiovascular system is ill, it's sick, suffering from all kinds of assaults from the food that we eat. So any direction that we talk about in terms of dealing with your blood pressure must first be dealing with the underlying problem. We've got to make you healthy. And then after you get healthy, as you get healthier, your blood pressure will reflect that and become lower. Now, normal blood pressure is defined by the general population, which is, let's just say 110 over 70 millimeters of mercury, measured by a cuff that you put around your arm. And you listen to the pulse come through the cuff, and you find out what the top number is in the system and the bottom number, the systolic and the diastolic numbers. And the numbers that are often given for normal are based upon average, which is 110 over 70 millimeters of mercury in healthy people. If the blood pressure goes up to 120 over 80, in other words, 10 points, both top and not bottom, you double your risk of dying of heart disease. But that's not because the blood pressure hurts the arteries. It's because sick arteries result in a higher pressure. So again, you want to focus on making the cardiovascular system healthy. When your blood pressure gets up to 140 over 80, many doctors will resort to the prescription pad. But recommendations are that you shouldn't start medications, official recommendations, like from the American Heart Association, the National Health Service of Britain, the Cochrane Collaboration, which is worldwide universal in its recommendations. They tell us we shouldn't start blood pressure medication unless the blood pressure is sustained. That means for months at a level of 150 to 160 over 90 to 100 millimeters of mercury. You know, very few people are at that level sustained, maybe on an occasion, on a high stress day. You know, something exciting is going on. You have a broken toe or something. You know, the blood pressure may be up on occasion, but sustained, it's not common for people to have those high blood pressures that require medications. And too often doctors have practiced based upon one visit. You go in the doctor's office, you're declared sick, that's it, you're done. You're on pills the rest of your life. But that's not the correct way of practicing medicine. So if you have high blood pressure that won't come down, the first thing you want to do is you want to get proper measurements. And this may involve frequent blood pressure readings that you take. How often? Well, I don't know, once a day maybe when you're trying to check things out. Certainly after you've become settled in with what you're going to be doing, you shouldn't check your blood pressure, but once a week or once a month or maybe less often. But you want to make sure your blood pressure is a real sustained level, or you really get a good average that you want to do. Now, as far as lowering the blood pressure with diet and exercise lowers blood pressure. Sunshine lowers blood pressure. But food is the primary component that you have for lowering blood pressure. I know when I say food, you think of salt and sodium. Well, this is a factor, and we'll talk about that, sodium. But it's more important that we look at the whole diet. The reason the blood pressure goes up is because you have caused the blood to sludge as a result of eating high-fat foods. I mean, animal fat and vegetable fat causes the blood cells to stick together, and a result, when the heart tries to pump blood into the cardiovascular system, there's tremendous resistance. And the body overcomes at least partially that resistance by increasing the blood pressure. So you've got all of this sludging going on due to the high-fat Western diet. The arteries go into spasm as a consequence of being in contact with bad cholesterol. Over years of damaging the arteries, you've developed blockages that also cause increased resistance. So you've got a tremendous increase in your peripheral resistance, which is where you want to direct your attention. And you want to offer the body a chance to have an easy blood flow by clearing out the cardiovascular system, you know, the arteries, the arterioles, the veins, et cetera. You want to cause them to have at least as little resistance as possible. And then the blood pressure goes down normally and naturally. Now, I know your first reflex is to think about sodium, but sodium is really the scapegoat of the Western diet. The amount of sodium you eat really reflects the amount of animal foods you eat. We're talking about bacon. We're not talking about the pig. We're talking about bacon, which is cut up pig drenched in salt. That's how salt gets a bad reputation. It's that it hangs around with cheese and meat, which are the things that really damage the cardiovascular system. But yes, you can lower blood pressure by reducing the salt intake and focusing on that alone. And it's an effort that you want to make, but the reduction in blood pressure is very small. If you lower the blood pressure to what's recommended, or the sodium intake to what's recommended, which is 2,300 milligrams a day, in other words, you reduce the salt intake of about 3,000 milligrams a day, which is, you cut your salt intake in half. You reduce your top number by 2 or 3 millimeters of mercury and your bottom number by about 0.6 of a millimeter of mercury. Not much. No, hardly any reduction in blood pressure through typical recommendations to lower sodium intake. Now, if you get real serious about lowering your sodium intake, which is what the rice diet uses, Walter Kempner's diet, a diet of rice, fruit juice, and table sugar, that's very, very limited salt, less than 500 milligrams a day. Walter Kempner used to wash the rice to get the salt off of it. And that kind of salt deprivation, you can get profound drops in your blood pressure. And on occasion, somebody has to resort to that kind of effort, a really simple, very low sodium diet. So our meal plan can be very low in sodium. The basic meal plan is about 500 milligrams a day. Just don't add any salt. Avoid the soy sauces or any other sources of sodium that are concentrated, like some of your canned tomato products. And you could easily be on a low salt diet following the basic McDougall diet. But you can go further than that. You can simplify the foods to the point where you're eating a diet that's very, very low in sodium, similar in the direction to the Kempner diet, a diet of basically one start fruits and vegetables. So when do you start high blood pressure medication? Well, we started at about 160 over 100 millimeters of mercury sustained. And the kind of blood pressure medication that I use is the one that has been shown to reduce the risk of stroke. Lots of blood pressure medications lower blood pressure, but as far as translating into a reduction in risk of stroke and heart attack, only chlorothalidone has been shown to do that. Not hydrochlorothiazide, not your typical diuretics that are given, only a brand called chlorothalidone. And that's what I use when I end up treating people who have high blood pressure that can't be lowered to a reasonable number with dietary change alone, which is very, very rare. And those people will start on a little bit of chlorothalidone, and in time, when they lose the excess body fat and improve their health even more, most of these people can get off of their blood pressure lowering medication. I'm Dr. John McDougall. I hope that's answered your question. You have some tools out there to prevent stroke and heart attack, which is really what you want to do. Secondarily, you want to make your numbers look good.